If you're a parent like me, you know what it's like to wake up at 3 in the morning with a baby screaming because they have a fever. And you know how frustrating it can be when the fever medicine doesn't either work very well, or you think you're giving too high of a dose for your child, or the dose isn't even written on the bottle. So I'm a pharmacist and a mother, and I developed the pain and fever dosing guide for infants and children. And the reason I did that is not only for me, it helps me a ton, but for other parents who also have to give their kiddos medication. I was rocking in the rocking chair with my sick baby. He was about, at the time, maybe 7 or 8 months old when he got his first really high fever. And I was sitting there at 3 a.m. thinking, okay, what's the dose? I'm trying to calculate the dose in my head and then try to figure out how many milliliters of the acetaminophen I'm supposed to give him. And I thought, I don't want to do this at 3 in the morning, and no one else wants to do this at 3 in the morning. So I developed the pain and fever dosing guide for infants and children that gives you the dose without even having to think about it. That was the whole point of this dosing guide. So I'm going to walk you through what's in this pain and fever dosing guide for infants and children so you can see exactly what's in here, why it might be relevant to you, and how you could use this in your day-to-day lives. I highly recommend putting this in your medicine cabinet before your baby gets sick or your child gets sick, so you have it with the acetaminophen and ibuprofen products. So when and if the time does come, because inevitably it does, you'll have this ready to go in your arsenal. So let's go over what is in this pain and fever dosing guide. So this is available on Amazon. It's $14.99. It's about the price of a burger and fries. So a very good investment for your children. If you type in the search bar of Amazon, pain and fever dosing guide for infants and children, it will pop up, or you can click the QR code or the link that is available on this video. So let me walk you through what's in here. So when you first open it up, it has the table of contents, nothing super exciting, but it does help you figure out where to go in the book. And then it tells you why you might need this book. There's multiple reasons why you might need this book. The dosing label for ibuprofen and acetaminophen say that if your child is under 2 years old, or if they weigh less than 24 pounds, ask the doctor for the dose. Now, we always recommend you ask the doctor before you give your baby any medication, but if they give you the go-ahead and say, yes, you can go ahead and give your baby medication if they need it, then you know you can use this dosing guide. But if the bottle says under 2 years of age or under 24 pounds, ask a doctor. That can be super frustrating, especially at 3 in the morning, because you're not going to call the doctor at 3 in the morning for a dose. So this dosing guide will give you the dose, which is excellent. Here are some disclaimers and warnings. It does talk about, this is information only. We want you to run this by your physician just to make sure that your child is getting appropriate treatment. But if your doctor has told you it's okay to give ibuprofen or Tylenol when your baby has a fever, that's okay. But it does go through some situations where you might want to seek medical attention. So infants who are under 3 months of age should always be evaluated if they have a fever. If they have a fever over 104 degrees, that's a significant fever. You would at least want to call the doctor. If they're unresponsive to medications, if they're unusually lethargic means so tired they're not really responsive. They're floppy, they're not really doing anything. I mean, most sick kids are clingy and really tired, but when they're lethargic, they're not responsive, they're floppy. That's an emergency. You need to seek medical evaluation. If they have shortness of breath or fevers lasting longer than 3 days, they should be evaluated. You want to make sure that these medications are safe for your kiddos. There are certain situations where acetaminophen might not be safe for your kid, or ibuprofen might not be safe for your kiddo. So just make sure with your pediatrician or family doctor that your child is appropriate for these medicines. And then, of course, don't ever use more than the recommended dosing. Aspirin should never be used. And then we do have some black box warnings on here of when you wouldn't use acetaminophen or ibuprofen. Again, the physician can tell you, and the bottles, the over-the-counter bottles do say it. So here's the reference. On this page, it tells you all of the products that are in this book. So we have the acetaminophen. It comes in children's acetaminophen suspension. It used to come in an infant and children's, but now they just put it all together in one product. Then there's children's acetaminophen chewable tablets. There's acetaminophen rectal suppositories, which are good for the little ones who just can't take suspensions. Maybe they can't swallow that much liquid. And then we have concentrated infants ibuprofen. Then we have regular children's ibuprofen. Then we have children's ibuprofen chewable tablets. These are all in here. Then we talk about how to give these medicines. Because this is very dose specific, the dosing cups are not always adequate to give the right dose. So we recommend getting these dosing syringes. You can get 5 milliliter dosing syringes, 10 milliliter dosing syringes. If you have a little one, 5 milliliters is fine. But if you have a bigger kid, maybe 4 or 5 and older, you might want to get the 10 milliliter dosing syringe because they're going to have a slightly higher dose. I recommend getting these at the pharmacy. So when you go to the pharmacy, you are buying ibuprofen or acetaminophen over the counter, you can go to the pharmacy and say, I'm buying these products, but I need an oral dosing syringe because I want to give the right dose for my baby. And they usually give it to you for free. If they don't, you can purchase some, probably there at the pharmacy, or you can buy them online or really anywhere that has, pharmacy products, over-the-counter products. And then it talks about how we dose these medications. So the recommended FDA-approved over-the-counter dose for acetaminophen in children is 10 to 15 milligrams per kilogram per dose, and then you give it every 4 to 6 hours, but no more than 4 times a day. And then the ibuprofen is 5 to 10 milligrams per kilogram per dose, and that one's every 6 to 8 hours, no more than 4 times a day. So they both have the every 6 hours in common. So I usually give the medicines every 6 hours, and if I have to alternate, I do the every 6 hour dosing. So that's how we calculate the dose. Again, we're pharmacists, so we calculated the dose, and I can't tell you how many times we double checked, triple checked, quadruple checked. We used algorithms, we used our own calculators, we physically did it by hand to make sure that all of these doses are accurate for your child. So know that we did our due diligence and made sure that these are approved, accurate doses for children, and they are the approved weight-based doses. And then when it comes to the suppositories and the chewable tablets, those are not as specific because they only come in certain standard doses. The rectal suppository is 80 milligrams. So you have to work with 80 milligrams. You can't titrate it like a suspension can be titrated. So then it goes into the infants and children's acetaminophen suspension. So if that's the product you're getting, it's red. Most acetaminophen and Tylenol products are red. The box is red. So we match the table with the color of the box. And you would find the product you're using. So this is infants and children's acetaminophen oral suspension, 160 per 5 milliliters. And all you do is you find your child's weight down the side. And then it tells you, if you wanted to calculate the 10 to 15 milligrams per kilogram per dose, how many milligrams your child would be getting. But really what's most important as a mom and a dad is you find the amount in milliliters, right? So if you have a 20-pound child, you would go to 20 pounds, and you would find that of this product, you need 2.9 to 4.2 milliliters. 2.9 milliliters, I would just round to 3, it's easier to pull up, would be the lowest dose in the therapeutic range, and then 4.2 would be the highest dose. So I would say anywhere from 3 to 4 milliliters is what I would pull up at 3 a.m. and get that fever taken care of. So this is the benefit of using this over the counter ibuprofen or acetaminophen dosing charts. Because like I said, if they're under 24 pounds or under 2 years of age, it's just going to tell you to ask a doctor. So here's the dose when your doctor says, yeah, that's okay, you can give it. 20 pounds, you can give anywhere from 2.9 to 4.2 milliliters. Super easy, and you can decide, do I want to give a high dose? Maybe their fever's not very high, or maybe I do want to give a high dose because their fever is 103.8, and I'm a little worried about them going even higher. So you can decide. And this dosing chart for acetaminophen goes all the way up to a 74-pound child, and the reason it stops at 74 pounds is anything over that is now just the adult 500 milligram dose, so you can just give them a tablet. But if they can't take a tablet, this will tell you how much of the suspension you can give. This child can get up to 15 milliliters of the suspension. So that's the first dosing chart. The next one is the acetaminophen oral chewable tablets. We only recommend this in children who can actually chew medications, so generally 2 and up, 3 and up maybe. And this one, because it's not a suspension, you can't really titrate the doses easily. We do have to give weight ranges. So it says, from 12 to 23 pounds, you would give them an 80 milligram chewable tablet. And so you just choose wherever your child is on this dosing chart, what dose they get based on their weight. Super easy. let's say you have the rectal suppositories and you have a child like mine that even with just a tiny amount of acetaminophen, when I squirt it into his mouth, he throws it up or spits it out or chokes on it and he's just miserable. Instead of dealing with the suspension, I give the acetaminophen rectal suppositories. So again, this one, because they come in specific tablet sizes or suppository sizes, you can't really titrate the dose, so you just have to choose. If your child is 20 pounds, they're going to get the 120 milligram suppository right across here. So those are the acetaminophen products. And then we have the concentrated infants and the children's ibuprofen suspensions. And we have a caution, caution, caution on this page. And then we have a bunch of caution, caution, cautions on the other page. The reason is infants' concentrated ibuprofen is more potent than the children's ibuprofen. You don't want to give your infant the children's dose of infant's ibuprofen. The reason is the infant's concentrated ibuprofen is more concentrated. That means that there's more medicine per milliliter than in this one, which means you can get away with giving them a lower amount of fluid, but still a higher dose. So this one is 50 milligrams per 1.25 milliliters. So for every 1.25 milliliter, it's 50 milligrams. The children's oral suspension is 100 milligrams, but that's in 5 milliliters. So you cannot mix the two up. We did purple to separate it from the children's ibuprofen because most ibuprofen products are orange. But if you're using infants, we want to make sure you're using the infant's dosing chart. I like the infant's ibuprofen. Again, my kiddo does not like the high amounts of liquid that come with the bigger doses. So I use this one. It's great to use. I just want to make sure you know that there is a difference between the two charts, because if you give your child the concentrated medicine, but you use this chart, you're going to overdose them by almost 2. So don't do that. And again, you use it just like you would the acetaminophen. You go down, you find their weight, you go over, you look for their dose. And if you have the children's ibuprofen, which you can give to an infant, you can, just make sure you're using the right table with the right product. You find their weight, you go across, and you find out how much you can give them. And again, you're given the dosing range, so you can choose, do I want to use a low dose or do I want to use a high dose? Not only do you need this for fever, but your kid might have pain. Maybe they broke a finger, or like my nephew got his finger slammed in a huge door at the church, and it tore open his finger, so he needed ibuprofen for a couple of days because it was swollen and it hurt so bad. But she was able to give him a lower dose of the medicine. But when our kiddos have very high fevers, I tend to give the higher dose. And you might find that on the dosing bottle, it'll say, 24 to 35 pound children all get 5 milliliters of the medication. But maybe 5 milliliters for a 35-pound child is the lowest dose they can get. Let's find out. For ibuprofen, 35 pounds goes anywhere from 4 milliliters all the way up to 7.9 milliliters. So you might give 5 milliliters for your 35-pound child because that's what the over-the-counter dose said. But they might not be responding. Maybe their fever went from 103 to 102.5, and you're sitting there going, I gave them medicine. Why isn't it working? Well, sometimes they just need the higher dose. So you can choose as a parent or caregiver what dose you want to give. So we have the infants and the children's ibuprofen suspensions. Ibuprofen for kiddos goes all the way up to 88 pounds because that's where the adult dose starts. So you can look at this and figure out the dose. I actually have a 10-year-old who weighs about 85 pounds. She's too big for the suspension, but I do look at this. She's 85 pounds, and it says that she can give anywhere from 194 milligrams to 386 milligrams. So I know what the milliliters is, but I can give her the pill. So they come in 200 milligram tablets. So I just give her a 200 milligram tablet, and sometimes I'll add a half a tablet to get a slightly higher dose to get her to 300 milligrams. And she's right in that dosing range. So not only can you use this just for the milliliters, but if you are curious, you can figure out the dose. It's given to you right in the middle of the dosing chart, so you know exactly how many milligrams your child can get. And then we move on to the children's ibuprofen chewable tablets. This is just like the acetaminophen. You would only give chewables to kiddos who can actually take the chewables and don't choke on it. And like I said, because they come in standard doses, this one's 50, 100 milligrams, 150, 200 milligrams. You can't really titrate it. So this is a weight range. and you just find your child in that weight range to figure out what dose to give them of the chewables. And then in the very back, we have these dosing schedules, and this is just an example. So if you have a child, what I would do is you would write down their name. This one's Emma Lou. She weighs 20 pounds, and this was on 2/10 of 2024 is when she got sick. And we marked that she got acetaminophen. She got 4.2 milliliters at 6 o'clock in the morning, and we gave her the suspension. And then okay, I gave her Tylenol at 6 a.m. Now I can give her ibuprofen for her next dose, 2.2 milliliters. Ooh, that makes me think she probably got the infant's ibuprofen. I gave that to her at 10 a.m. and I wrote down concentrated infants. So I knew I gave her the more concentrated, lower liquid amount, but the higher dose. And then I gave her back the acetaminophen again, and then I did the concentrate. This is just an example of a dosing schedule. We have 2 separate samples. This one is Henry. He weighs a little bit more. He's 36 pounds. This one talks about, he used the chewable tablets instead. But we have 20 of these dosing guides in the back of this book. So you can use these for hopefully a long, long time. But I would recommend 1 dosing schedule per kid. So like I'll put child A on this one, and then child B will be on this one. And this way I can mark exactly what medicine, what dose, what time, and any notes. You could put, I gave the suspension, I gave the chewables. Or you could put, they had a fever of 103.5, and then you can go, okay, 3 hours later, their fever's down to 99. So it makes you feel good that you're actually doing something for your kid. The other really beneficial thing of these dosing schedules is not only is it hard to track which medicine did I give and how long ago, so what am I due for next, but it helps you track multiple children, and it also helps you communicate between caregivers. So let's say I have somewhere to be and my mom has to come watch the kids, and she's like, well, I don't know what medicine they get next and what time. I just give them this dosing chart, and she'll say, it looks like so-and-so got ibuprofen at this time, so they'll be due for acetaminophen in 3 hours. So this really helps caregivers go back and forth and just keep track of the medications for the kids. So that's the whole dosing guide. It is truly one of the best things you can put in your medicine cabinet. I know people say, the dose, you can get the dosing online for free. You can get the dose on the OTC labels for free. I get that, but this gives you so much more. It allows you to decide high or low dose, which product you want to use, track your kids' medications, and it just gives you the tools to actually do something that will treat your child not like a cookie cutter kid that everyone's getting the same dose because they're in the certain dose range, but you can actually decide what is best for your child to make them feel better. It's also nice that at 3 a.m. you're not looking at a screen trying to figure out the dose. You're looking up Tylenol.com to figure out the dose. You're not calling your doctor at 3 a.m. in the morning or waiting for the doctor's office to open. This book is it's just there. You just grab it, you look at it, and you say, okay, I'm going to give my baby who's 20 pounds acetaminophen product, and I'm going to give them 4 milliliters. And you draw it up, you give it to them, you snuggle them, and within 2 minutes, you're all back to bed. That's the whole goal, to make this convenient, easy, and it's the easiest product you'll ever buy, and truly the most convenient product, especially when your baby is sick. So get it now, before your baby gets sick. This is really good for children. Probably 6 and under is ideal, but you can use it all the way up till adult dosing, so 10, 12 years old. Again, pain and fever dosing guide for infants and children. This is available on Amazon.com. I will put a link in the comments below, and or you could just type in pain and fever dosing guide for infants and children. And I do request that if you get this book and you do love it, I ask that you review it on Amazon, because the more reviews you get, the more it's going to get out there, and we want this book in everyone's home just to make it so easy and convenient for all of the parents out there. So pain and fever dosing guide for infants and children. Also, don't forget to subscribe to this channel so you can get more information, because I give tips and tricks on how to best dose your medicines. We have natural remedies. We have all sorts of just pharmacists, tidbits and advice that we can give out there. So subscribe. Get the book, get it for your family, get it for your children who have children. If you're a grandparent, get it for baby showers, whatever. It is the best book any parent of young kids could have.